Okay, so focusing today on disruptive behavior disorders in childhood and adolescence. So these are characterized by poorly controlled, impulsive, acting out behavior in situations where self-control is expected. So pause here, read this case study, and then we'll talk about how it applies to an understanding of attention deficit hyperactivity disorder. Okay, so attention deficit hyperactivity disorder, or ADHD, is characterized by this incessant restlessness, extremely poor attention span, which leads to impulsive and disorganized behavior. So this is far more common in boys. Oftentimes we also see it in conjunction with conduct disorder, which we'll talk about here in just a minute. But there are children here who show symptoms of inattention. They show hyperactivity and impulsivity. Most children with ADHD have a wide range of problems. They still show the disorder into adolescence, and many of these kids will develop antisocial behavior. So for these children, oftentimes this particular disorder is not noticed until the kids start school, because once they start school, they have to sit still, they have to pay attention, and these kids have a really, really challenging time doing that. ADHD can also lead to problems in interacting with other peers. So oftentimes these kids, because of their impulsive behavior, they can be the class clown. They're the kids who are always getting in trouble, always getting yelled at by the teacher. And in peer interactions, they can be really intrusive, annoying, or distracting. So these kids have a hard time reading social cues. They have a really difficult time, waiting their turn for things when they're playing with other kids, reading other kids' emotional state and modifying their behavior accordingly. And so some kids do not want to play with them. They find them very intrusive, annoying, or even distracting, especially within a classroom. So how do we treat ADHD? There are stimulant medications such as Adderall and Ritalin, which actually stimulate the production of dopamine in the brain. So remember, dopamine is that neurotransmitter. It's involved in learning, in memory, and also in attention and focus. So it increases the release of dopamine in the prefrontal cortex of the brain. And the prefrontal cortex is that part of the brain that's involved in planning, judgment, being able to inhibit impulses. Also, child and family therapy, very, very important. So oftentimes we see that kids who have ADHD don't have very high self-esteem. They're constantly, down on themselves because they're getting in trouble all the time at school. They might be rejected by their peers. So part of the goal then is to work with these kids on figuring out how to bolster their self-esteem. Additionally, working with these kids on cognitive techniques, so impulse control, stopping and thinking before engaging in a behavior, thinking about the potential outcomes, and then also working with the parents. So sometimes parents of kids who have ADHD don't have the strongest parenting skills. So they're not setting limits for these kids. They might kind of let the kids decide what they want to do, when they want to do it. And they might not be consistently enforcing consequences for behavior. And so this becomes something that is very, very important for children who have ADHD. Okay, so I want you to pause here, read this case study, and then we'll apply it to our other behavioral disorders. Okay, so additional disruptive behavior disorders in childhood and adolescence, we have two here: oppositional defiant disorder, or ODD, and conduct disorder, or CD. Both of these involve basically very disruptive behaviors, but oppositional defiant disorder is considered less severe than conduct disorder is. So with oppositional defiant disorder, these kids show these symptoms by age 8, but no later than early adolescence. Oftentimes the child has a difficult temperament to begin with. These kids are chronically angry, vindictive, spiteful, argumentative, and volatile, and they openly defy adults' rules and requests. However, it does differ from conduct disorder because these kids do not violate the rights of others, they don't steal, they don't force other people to do things, and they don't engage in cruel activities like kids who have conduct disorder do. In conduct disorder then, we see that the age of onset is really, really important here. So children who have an earlier onset, so kids who are early starters or who have childhood onset with at least one symptom before age 10, tend to have a more severe prognosis. These kids are usually male, physically aggressive, have very few friends, and if you remember from the chapter on personality disorders, the diagnosis of conduct disorder is required before the age of 15, right, as a precursor to antisocial PD. Many kids who have conduct disorder commit serious crimes, and many of these children come from very disorganized and unhappy families, and this can definitely lead to a poor prognosis. So kids who have conduct disorder, they are very aggressive against other people. This can include things like forcing other people to do things. They might force other people into sexual activity. They might torture animals, severe destruction of property, starting fires, for example. And they are consistently and severely violating the rights of other people. So conduct disorder is the more serious of the two. Sometimes children who have oppositional defiant disorder will start with that and then develop into conduct disorder, but of course it does not always happen that way. In looking at treatment for these particular disorders, family therapy seems to be very effective, particularly something called multisystemic family therapy, or MST, where you are working with all of the providers in the child's life. So these are healthcare providers, mental health providers, the school setting, the family setting, working to create consistency among these settings in expectations for the child, and working with the parents on consistent enforcement of behavioral standards, consistently and appropriately punishing negative behaviors, and teaching parents to focus also on positive behaviors. So oftentimes, these kids only get attention for their negative kinds of behaviors or their disruptive kinds of behaviors. And so teaching the parents how to focus on some of the good things that their children do can be very effective.